One thing I've noticed is that men in their 20s oftentimes have very rapid hair loss, and that hair loss starts to slow down as they enter in their 30s and 40s. Not always the case, but that is one thing I've noticed. I think one of the reasons why this can be the case is that men's testosterone levels diminish somewhat as they age. The one risk factor, though, is men that are taking exogenous testosterone, in other words, supplemental testosterone, and that can cause further hair loss may need to be managed more aggressively with medical therapy than otherwise. The one thing is, I'm not trying to tell you not to take testosterone, because obviously low testosterone can cause a lot of side effects that are very unpleasant for men in their middle ages. But it is also something that I want you to be careful with, especially if you're suffering from hair loss. And if you're listening to this podcast, you probably are. So it's one of those things that I would be very careful with, even for women, if they're getting testosterone replacement. Just be careful if that's causing further progression of hair loss. Now, what are things that you can look for? Well, first is your symptoms. If you are actually having progression of hair loss and you just started testosterone, you may want to be looking at that as something to be very careful about. And then I would work with your doctor to say, okay, well, where are my limits? Some people say, well, I'm in my normal range. Why would that actually cause a hair loss issue if I'm in the normal range of testosterone? Well, there's several reasons. First of all, the normal range is something that's very arbitrary. We define normal range to an average of individuals saying this is what we define as normal, but it may not be normal for you. And that's one thing when we talk about, for example, functional medicine or medicine that is intended to optimize your body. Oftentimes these normal ranges are out the window because we don't necessarily follow something that's exactly within what we call normal. And so you could be also high normal. High normal may not even be normal, as I just alluded to. So you want to be really careful is if you're seeing progression of hair loss with your testosterone therapy, is to really either increase your anti-DHT therapy like finasteride. Let's say that you were getting by with finasteride 3 times a week or once a week or 4 times a week, and then all of a sudden you're seeing this. You may need to increase it. You may need to add minoxidil. You may need to start finasteride if you are not on it, or you need to adjust your testosterone. So the easiest way is obviously to adjust your testosterone. Now, I'm not an endocrinologist. I am not an anti-aging doctor. I'm going to leave it up to them to counsel you appropriately on that side of the equation. At the same time, I am a hair loss surgeon, a hair loss physician. I am focused on managing someone's hair loss issues. So, of course, there's a variety of other things that can cause hair loss in men or women. But I just want to talk about the fact that not to assume that normal is normal, and not just to say, well, it's just testosterone, I'm not going to be worrying about it. The doctor is going to treat me appropriately, and I'm just going to deal with whatever happens. But I really want to encourage you to think about that in context of your hair loss and to look for your symptoms of what's going on.